sideline technique brings great opportunity, but also great challenge for us as massage therapists. Just out of interest, how many of us sleep on the side? Majority. That means the side, lying on the side, is a comfortable position. Yeah? It's comfortable position, people like it, they feel comfortable with, the muscles would be relaxed. However, it creates a lot of instability in there. So when you start thinking about massage, you can get into actually moving and causing the client to be seasick. We don't want. So first of all, before you starting sideline, we have to really master the positioning of the client and draping them. Okay? So let's start. Yeah? Let's start with the neck. Actually, I'll put you into a quick movement in there. I'll ask you to come very close. Yeah? The camera especially from here, maybe even from there. Yeah, all the way there. Yeah, good. And what I would like to show you is that when you're massaging the neck, you have to have the neck in a stable position. Now, let's take, for example, this case. Put your in here and slouch a little bit, yes, like that. What happened in this scenario? You see that the pillow is going straight onto the according to the table. Our client head on the other side is more forward. Imagine like a line between the ears to the eyes. Do you see that line? Mm-hmm. That's kind of the axis of the head. If I will now massaging her head, the head would fall forward and her neck muscles will need to contract in order to keep that. So it's kind of a catch-22. You're trying to relax, but actually nothing happened. So you have to accommodate the pillow to their head. Lift your head, please. Good. Now you need to do that simple thing that will make her neck to be comfortable. Yeah? Now another thing that can happen, lift your head, that I do it, but actually now you can relax, but the pillow is actually very, it's not in the center. So whenever I do, the inclination of the neck is to fall forward. So I need to really put the pillow not only in the right angle, but also right centered there. Lift your head again, good. And try to stick the pillow kind of all the way to their neck so they feel comfortable. Don't leave the pillow kind of far away from their body. Okay, so this is one thing. Second thing, the leg. If you have the leg straight, and you start massaging, you see what happened. Mm-hmm. So to stop that, you need to bend the legs, yeah? And I would say even put a pillow, teddy bear, in between that. Okay? So it's kind of nice, comfortable. It's really comfortable. You should have a really nice time massaging and be massaged this way. Okay? Let's talk about towels. What you can do is ask them, can you tuck this under here? Thank you, good. So you can use that. And then for when you're massaging the back, you would just kind of fold that on the side and you have a nice approach to, sometimes you would use their hand to hold the towel so it does not expose the front part of the body, and then you can go forward kind of very nicely. Okay, so it really the first bit, and I would suggest even to kind of give you enough time to do that, is really master that part. Because if without it, no good. It's the challenge really. Challenge to set it, and do take the time to do that, even if it's taken extra minute, because when they're feeling relaxed, your capable of doing your work, and if not, it's really defeat the purpose, and it does take time a little bit, and exercise to do it. Yeah? Good. What I would like then to show you, generally, think about someone, remember our client with this kyphotic, seated position, headache, neck pain, right? So here we have, that client, and what you want to do first is look at that and really identify the muscles. Where are they? So upper trapezius would be tight, levator scapula would be tight, the shoulder might be a little bit forward, yeah? So really, in your treatment, you want to actually undo it, yeah? So let's start with some mobilization, okay? The first mobilization I want to show you, and I'm going to do a little mobilization because I want you to practice the positioning more than anything else. The first mobilization is to reduce the kyphosis in the upper back. So imagine someone kind of sitting on a computer, lying there, and then what you want to do is actually the opposite. Do you see that kind of movement from here to here? So how can you do that? You need to support the shoulder, and the other hand's coming from there. Come around maybe into the other side. Yes. Now I will start really with my position because I can do it this way, but I need a lot more. I need to position myself a lot better. That hand support the shoulder, and the other hand now reduce the kyphosis. And you might need to move a little bit more into here.
She's start without water.
Are you alright?
Yeah. Well, I will start slow.
Venkat, you want to
And
put
light.
it on here? It's better in here.
Yeah. And then you can do it from here. If you want to do it even stronger, what you can do is drop the shoulder here and then put the shoulder. Do you see what I'm doing? I'm trying to bring the shoulders back to here and then push it together. And then I use a lot of weight from my body. Try not to do it from your back, but really the front knee bend and the weight drops. So the top hand does that movement and the lower hand that movement. So it's actually almost opposite directions to bring the shoulder backward and the thoracic spine forward. Now the rhythm, you can't attack it, but on the other hand it's kind of heavy. So you need to really put your weight on. I am on the side of the spines. Sometimes I can feel the spine, so don't worry about that. And then I can change and do the same thing from the other side. Again, as long as the aim that I have is to open the thoracic spine, that's fine. So that would be the first one. So I'm not going to show you other mobilization, just those that needed. What do you think for a seated person, what happened to their neck? Is it very elongated or contracted? Contracted. So what you can do is from that position again, come into here, yeah, and start to maybe push the shoulder downward and then elongate the neck that way. So you can do it only on the upper trapezius shoulder. So you kind of push the shoulder down while massaging the upper trapezius. And then take care of the erector spine a little bit, occipitofrontalis, suboccipital, levator scapula. I always prefer to push than to come from here and do it this way, but it's possible. Both are right. It's just a question of personal. You can do that in here. You can massage when you're doing it. So it's two things: petrissage and shoulder, and taking the shoulder downward. You can come from here then, from that side. It's now very simple to work on the erector spinae muscle. Suboccipital, occipitofrontalis, scalenes if you want. Okay? Shall we leave that? I'll let you first of all really to look into the position. Look carefully the two pillows, how to position. If you have only one pillow, you must use it on the neck. Another thing is the pillow thickness. It doesn't matter how many pillows you have, but you need to create a straight line between the spine and the neck. If you have pillows that are very thin, fluffy, like down feathers, you need to either fold them or having more pillows as long so that the neck would be straighter. You can't work with a neck that is down or too high from the table.
Okay.
So that should be a straight line, you know, more or less. Fine, yeah? Let's go. Less problem is to just say, could you come in line your right side? You're doing that, yeah, good. And then you bring them the pillow. Now on the way, just a minute, no, not yet. You're calculating where to put the pillow. You're coming over here, lift your head. Thank you. And you kind of put the pillow right in the place. You're calculating where the position should be. Then, come and bend your legs. Lift your hands, good. Good. Now, in a real treatment, I will have two towels, yeah? So I will still use that towel over here. Yeah. Put your hands up. Can you bring it? Yeah. And tuck this underneath. So it can get quite faster to do that. Yeah. Good. I will use now oil. Yeah. Can I undo the bra?
Yep.
And then I can fold the towel this way. It's kind of similar to what we've doing before. You can do the effleurage same way. You can come from the above and do it, or actually from the other side. Now when you do that, be careful not to be coming too close, especially if you're coming from above. So be aware to where your body is and how much space they need. Then petrissage. Here there is really a lot of opportunities here. And rather than telling you a specific technique, I will do again approaches to where your position could be. So you can position yourself from the opposite side. Yeah. And you can work really on the erector spine in a way that you're not used to, from the side. Yeah.
You've noticed when doing it, you actually feel the side of the spine. It's
Yep.
quite interesting.
You can come from above, and then you can work on the upper trapezius, yeah, rhomboid area, levator scapula. You can do a nice compression, friction into here, and kind of hold it. Then you can come up to the neck. On the neck, you can come again from that side. Now, if you come very close and even with the camera, even higher, so come into standing. Now, what I do with the neck is that you see that the neck is over here, the muscles are here. Now, I can lift my hands this way, but I prefer to have, do you see that I put my hand on the jaw?
Mm-hmm.
Because it gives me stability. So always try to find this kind of stability where either here or here on the shoulder. Try not to have no supported position this way. And then you can almost like challenge the body to do neck, and then you can move the shoulder even, or just keep the shoulder in a lax position and work more on the neck. And even just hold it there. Most of you, I would say, needs to slow down. Slow down and work slightly deeper. When it comes to effectiveness, that's, doing a lot of strokes, kind of miss the point a little bit. And then from here, you can do a nice stretch. Yeah. You can work with your knuckles again. You can come to work on the suboccipital area. Yeah. So my hand is kind of in the groove. Yeah. Feel the groove, find it, and just work on that. And then from here, you can work on which muscle am I now? Temporalis or occipitofrontalis, yeah? Raking it, yeah? Like collecting the grass. Good, even go onto the forehead and work in here. Have we done shoulder mobilization? Have we done that one, relaxing the hand?
No.
No? That's a fantastic technique, yes? So how do you get into there? You put their hand up, you move your hands, and then you ask it to drop. And then you have the other hand on the upper trapezius. So the emphasis is really on long, slow movement. And then you can do it with massaging even. Yeah, so hand. Even a little bit on the spine here even, tugging the spine. Yeah. So it's just endless, really. You just keep inventing and forgetting and doing other things. So that's what I'm saying. I don't want you to learn technique. I want you just to learn the approaches and let your hands to invent new technique and then do it. Okay. So the approaches is really your position. You can do it from the opposite side, from above, and from the other side, and from below here. Yeah? I gave you a bit of taste, and then try and see what works for you. Okay? Sitting?
No, I just wanted you to do that one again with the hands. Lift up the arm.
Mobilization.
Yeah.
So it was your right arm you used.
It was the lower arm. My lower arm, and this is the above. This is the arm that's close to their head. Yeah? And then you can do that. You can do that from the opposite side also.
Was it nice?
As you are coming from here, again, lower arm, and then you're moving it.
Really good.
Yeah? And then you from that area.
Which one?